Using conventional treatments in innovative ways is helping some late-stage cancer patients get surprisingly better outcomes.
I feel better now than I felt in years.
After 18 years of being in remission, all the physicians were pretty much offering me the same type of chemotherapy which I had back in 1988.
I've had doctors that said, if you take supplements or anything like that, we won't even bother to treat you because it interferes with chemotherapy.
Most patients found us when they started really searching because their conventional therapies had already failed them, and they were looking for something that would be a middle ground between two worlds.
Integrative cancer specialist Dr. Keith Block founded the Block Center in Evanston, Illinois. He and his wife Penny have been offering a more personalized, non-conventional practice there since 1980. Dr. Block's work with his patients is contained in a book called Life Over Cancer.
We're now seeing many more patients that have early stage disease and even patients with high risk.
I had one doctor say to me, "Hey lady, you're terminal," in exactly those words.
Diane Klinke was diagnosed with pancreatic cancer 6 years ago. She was given the devastating diagnosis by oncologists at 2 different hospitals.
You don't have a lot of time. It's not a good situation, but we can refer you back to local doctors.
Not surprising, since less than 5% of those diagnosed with pancreatic cancer are still alive after 5 years.
Diane came to us with a metastatic pancreatic cancer with liver metastases, a very, very grim disease and prognosis. And we started her on a full comprehensive integrative program so that the environment surrounding the cells was really an environment that combated rather than coddled the cancer cells.
I felt a lot more positive rather than sitting there helpless that I'm going to be a victim of cancer. They put you right away in control. Here's how we fight the cancer. Here's how we involve diet and exercise.
A modified diet, supplements, and exercise helped strengthen Diane for the side effects like nausea and vomiting. But it was the integration of an old treatment in a new way that actually saved her life.
We gave her chemotherapy, but we did it in an innovative way.
The treatment system used to shrink Diane's 4 tumors is called chronotherapy and is FDA approved.
We ended up timing the drugs in terms of a circadian clock with the drugs in order to capture more cells during the dividing period while quietly giving the chemotherapy when the healthy cells were at rest so that there would be less toxicity.
You walked around with a pump, you did all your normal activities.
The chronotherapy treatment, combined with a daily regimen of 35 pill supplements, has Diane currently in remission since late 2005.
I've gotten letters asking me if I would like to participate in research and find out why you survived. If it weren't for Dr. Block, I wouldn't be here.
My tumor shrunk 25 to 30%. Some of the cells in my lungs are actually dying.
Bob Linden had colon cancer surgery in 2009 and learned it had spread to his lungs. He chose to be treated with an integrative approach at the Block Center.
I don't condemn conventional medicine. I had great care in the hospitals I was in. But there's just another way to view this and another way to look at it, and you got to be your own advocate.
The public needs to know there's more that they can do.
Psycho-oncology director Penny Block helps patients deal with their emotional and nutritional concerns.
People have to believe this is going to make a difference, and I can do it. The amazing thing is that our patients are sitting down and enjoying food while they're getting chemo.
These veggies, they're very high in antioxidants.
The first decade I was in practice, I was attacked because how dare me think that nutrition could be relevant.
It's very important to get the right kinds of oils.
The second decade, believe it or not, I was actually attacked worse by the alternative community because how dare I use chemotherapy?
Besides the chronotherapy treatment and a modified diet, the other component of Dr. Block's integrative program includes the use of the right combinations of supplements.
Ginger capsules can reduce substantially the nausea and vomiting that patients get from chemotherapy. We also are looking at now different ratios of fish oil because it can actually boost the effectiveness of chemotherapy in some preliminary research.
But the research study to support his use of supplements have been limited to small groups. So how is Dr. Block able to treat his patients safely without large clinical scientific studies?
Some of the treatments that Dr. Block does are based on science and the evidence that does exist, but it doesn't come from randomized clinical trials.
Dr. Lorenzo Cohen heads the Integrative Medical Program at MD Anderson Cancer Center in Houston. He has been reviewing Dr. Block's treatment methods for several years.
There's a lot of non-conventional practitioners out there who are starting to do some of the clinical care along the lines of pure integrative oncology, some of which we know that there is some evidence for benefit. There's actually evidence to suggest that chronotherapy and providing chemotherapy based on circadian rhythms is very important to do, but it's something that's challenging to do within our conventional system.
Marlene Kreisig was diagnosed with recurrent ovarian cancer after 18 years of being in remission.
It's easier. With the supplements, they help to curb some of the side effects. They will modify the chemotherapy, whereas last time that just didn't happen.
Marlene, just like the other two patients of Dr. Block, all take anywhere from 25 to 55 vitamins and supplements a day.
It doesn't bother me because I'm so happy with the results.
We're asking patients to do a lot. Having said that, we're switching to nanoparticles as we speak, so our core program will be about 8 to 10 pills twice a day.
In some of the papers I've seen of Dr. Block's, what he's trying to do with many of the patients is get them up to the appropriate recommended daily doses of certain vitamins and minerals that a lot of people in our society are below, in particular vitamin D.
Even without the large clinical studies, Dr. Block's patients are grateful for the results.
You know, you just gotta work at it a little bit, that's all.
We have these little group things all the time. I mean, there's people that have been in remission, given, you know, a year or two to live, have been in remission for 10 years or more.
But if we didn't witness enough good results, Keith and I couldn't for 30 years keep coming back every day. And that doesn't mean all the time. It doesn't mean all the time. It just means enough.
Catch more of this story on Fox News Reporting, Winning the War on Cancer, Sunday at 3 p.m. and 9 p.m. Eastern. I'm Dr. Manny for Fox News.